Hello and welcome to another explainer video. It is another one on fluid therapy, as I've done a couple around fluid therapy recently. And this one is just going to be quite quick, talking about potassium supplementation and the Kmax calculation. So what that means is, quite commonly in practice, we need to supplement our patients' IV fluids with potassium. We'll go into why briefly, but there is a certain amount of potassium they can have per hour or per kilogram per hour. And we can't exceed that. It's really important that we do not exceed that, or we may start to see hyperkalemia or high potassium levels in the blood and signs associated with that, which we'll also get into. So basically, this video is just about potassium administration, potassium supplementation in IV fluids that we do very, very commonly. We commonly throw 20 millimoles of potassium in a 1 litre Hartmann's and put our patients on it. But what you might not know is that there is a maximum dose that your patient cannot exceed with potassium. And you may not know this, and if you do, you may not know even how to calculate it. So this is just a quick one that I figured you can save. And next time you've got a patient on potassium supplementation in their IV fluids, maybe try this calculation and just check they're under that amount that they're allowed to have. I'm absolutely sure that they will be. It's a cool thing to check. So first of all, a little bit about potassium. Potassium is an intracellular cation. It is found in abundance within cells. It likes to be in the cells, and it is positively charged. Hence, it is a cation here, and this is its symbol. It's a K plus. And when we talk about potassium being high in the blood, we call it hyperkalemia. And when we talk about being low in the blood, we say hypokalemia. So sometimes that kalemia part was something we've got to start associating with potassium. It's not something that you say commonly. The role of potassium is it helps with nerve, muscle, and heart function. So it is super important. And animals mainly get their potassium from their diet. So it can be quite common in patients who are not eating, which is a lot of our sick patients, that their potassium does become depleted and they become low in it. Hence why we commonly need to supplement it. And usually that's via IV fluids when they're sick and not eating. If they are eating, then we can give it, the vet may prescribe oral supplementation for potassium. And we test potassium via several methods. Usually it's part of our electrolyte panels on our IDEX machines, or we may use a blood gas analysis device to test it. So there are different methods of testing it, but generally it's pretty commonly tested as part of an electrolyte panel. So when potassium becomes low in our patients, we said this can be quite common, especially if our patients are anorexic. Hypokalemia or low potassium levels in the blood can also occur through diseases such as chronic kidney disease, diabetes mellitus if it's poorly managed, and any patients that are receiving diuretic therapy or diuretic medications can become hypokalemic, so quite commonly seen. And hypokalemia or low potassium levels in the blood generally results in muscle weakness. We can see that kind of bending of the neck or that ventral flexion of the neck is quite commonly seen. In its severest case, it can cause paralysis, but quite commonly we see the skeletal muscle weakness. So first of all, we have to look at what is normal. As with everything, there can be differences in textbooks, but generally I've gone with Cornell here and the University of Cornell, which is a pretty reliable source. In a dog, they would say 4.1 to 5.4 milliequivalents per litre. So we can then look at the dosage chart and see what we'd supplement for the amount of potassium in a patient's blood. So under 2 is really severely low, and this would ask that we'll just go with a 1 litre here because it's kind of the most commonly given. We don't often give 250 ml fluid bags, but you would want to ideally, or your vets will be guided to supplement with 80 milliequivalents per litre. So putting 80 milliequivalents or millimoles into a 1 litre Hartmann's bag if that's what the patient was on. But also quite serious, this is quite seriously low, but 2.1 to 2.5, they recommend putting 60 milliequivalents into a 1 litre fluid bag. So 2.6 to 3, it's 40. And so on. And 3.6 to 5 is the 20, which is generally commonly, you always have to check how many milliequivalents are in the vials that you're given. Commonly the ones I'm used to is 20 millimoles per or 20 milliequivalents per vial. There is also a bit of a cheat sheet for maximal fluid infusion. So, your vets don't have to work it out. So that is there as well. But let's just say that's not there. We're going to work it out. Some important things to note first: when you add potassium to a fluid bag, whichever size bag that may be, we always want to rotate that bag really thoroughly. Okay, we don't want potassium, for the same reason we don't want to give large amounts of potassium in one go. We don't want all the potassium that we put in the bag to sink to the bottom and the patient's going to get that. Okay, it can cause real serious problems. So you want to rotate the bag really well. We want to label the bag ideally before you even spike the bag with the additive. This is kind of just my hot tip, but I never spike a bag without that bag being labeled first, because I think if my tension gets, if patient just seizures behind me and I have to act quick and go, and another nurse comes along or a vet and thinks, oh, there's a bag of Hartmann's, I'll pick that up. They have no idea that I have actually spiked that bag, and by spiked I mean put the additives in it or injected the additives into it. So hot tip for me, and one thing I always teach, is label your bags first. Also put the dose of which you've spiked the bag with, and never use that bag for flushing, for the same reason we don't want potassium to be going quickly into a vein. So we don't want to be flushing medications through with it. We don't want to be clearing IV catheter blocks with it, or blockages or occlusions, and we don't want to be bolusing our patients with high rate fluids when they have potassium in. If you need to bolus your patient, if your vet asks you to do that, set up a new bag that is free of additives before you go doing that. And it's a really, really essential habit to get into, checking your fluid bag before giving a bolus. Okay, so what is Kmax? Well, Kmax is the maximum dose of potassium that you can give. So ideally, it should not exceed half a milliequivalent per kilogram per hour. Complications of exceeding the Kmax, so this half a milliequivalent per kilogram per hour, could result in the signs of hyperkalemia that we see. So think the cardiac arrhythmias, including bradyarrhythmias, and we can see those changes on an ECG. I do cover that in other webinars, and it eventually can lead to atrial standstill. So it can be really damaging to the heart to have that excess potassium in the blood. So the calculation to work it out, so this is us working out we've got a patient on fluids, it's being given potassium, and we are working out if the potassium it is being given at the rate in which the fluids are going, if that is within or under this Kmax here of half a milliequivalent per kilogram per litre. So there's 3 steps to the calculation. First of all, we need the size of the fluid bag that we're being given. We often work in 1 litre bags, so there is 1,000 mils within that bag. And we need the fluid rate of which the patient is on, so you get that from your vet. And that, by dividing those 2 things, the amount of mils in the bag and the fluid rate in mils per hour, we're going to get the number of hours that fluid bag will last our patient. We then want to take the total amount of potassium that the vet has asked to be supplemented, and we divide that by the number of hours in that order. So take the amount of potassium that you're going to be supplementing and divide it by the number of hours the bag will last, which you got from step 1 here. And that is going to give us our milliequivalents per hour. Okay, but our Kmax is actually in milliequivalents per kilogram per hour. So we need a third step. We need to divide our milliequivalents per hour by the patient's body weight, and that will give us the milliequivalents per kilogram per hour. So as I said, this will be really good to save later if you do either ask to work this out or are interested and want to work it out. So let's go through an example here. We have a 4 kilogram kitty cat. The vet has asked us to supplement 20 millimoles or milliequivalents of potassium in its fluid bag, and it is on a 1 litre Hartmann's. And the fluid rate that the vet has asked you to put the cat on is 15 mils an hour. So that's everything we need to do our calculation. I will just say as well, there is potassium in Hartmann's. Do you take the potassium in Hartmann's and add it to the potassium that the vet is asking to supplement? Yes, you can do. It's also the amount of potassium in the Hartmann's itself is negligible, so it's not going to make a great deal of difference. So I haven't included it in this one, but you could add it on. We want to take what was first step. So the amount of mils in our fluid bag divided by the fluid rate the cat is on. So we have 1,000 mils of Hartmann's because it was 1 litre, and we're going to divide that by 15 mils an hour, which is our fluid rate. My calculator tells me that works out to be 66.6. So this means that this 1 litre fluid bag, if going 15 mils an hour, will last 66.6 hours. Heaps of time. The vet has then asked us to add 20 millimoles or milliequivalents to this 1 litre bag. So we'll take 20 and we divide that by the number of hours the bag will last. That is going to give us the milliequivalents or millimoles per hour, which is 0.3 milliequivalents per hour. But as I said, we need a final step. We need to take that 0.3 and we divide it by the patient's body weight. That was 4 kilograms. And that gives us a total of 0.075 milliequivalents per kilogram per hour, which is well under the Kmax, which is 0.5 milliequivalents per kilogram per hour. So this is an extremely safe dose to be giving from a potassium point of view. Obviously, that's not to say that the fluids themselves are not too much or harmful to the patient. That you're only going to know through monitoring your fluid therapy, which is another video that I've also done as part of this fluid therapy series, because why not? Hope that was useful. Hope you can save it. Hope you can use it in practice. Bye for now, guys.